Hi, I'm Eric Walden, Executive Director of the Poore Medical Clinic. Today we're at our downtown location, the main medical clinic at Fine and Humphreys in downtown Flagstaff. The mission of the Poore Medical Clinic is to provide professional primary medical and dental care to people of Coconino County who have no insurance and are living at a poverty level. Dr. Poore had been a community doctor in town for about 50 years or so, and he saw this need in our community and came up with the concept for the Poore Medical Clinic to provide primary medical and dental care to people who meet all three of the following criteria. They're residents of Coconino County, they have no health insurance whatsoever, that includes Access, which is the state of Arizona Medicaid system, and they are living at or below 250% of the federal poverty limit. And if a patient meets all three of those criteria, they can be a patient here for medical and dental. And they receive that care at no charge at all to the patient. Your first appointment with a medical provider is 1 hour. And when was the last time you spent an hour with your primary care doctor? And the reason we have an hour to do that is for our providers, our medical doctors and our practitioners to get to know the patient and get to understand things about them and their family so they have a larger picture of the kind of care they are providing. What's really important about the Poore Medical Clinic to understand is we are the only agency in Northern Arizona that provides this patient care absolutely free, no cost to the patient whatsoever. All of our medical providers and dentists and nurses and assistants and hygienists are all volunteers. They are fully licensed and certified professionals as required by law, but they volunteer their time and care to our patients here. I did a thumbnail financial estimate once that if we paid all of our doctors and nurses and dentists and assistants at the going rate in Flagstaff, we'd have a payroll of over $6 million a year. And that's not sustainable, I can't do that. So this model works because of the generosity of our medical and dental providers. Our providers enjoy volunteering their time with our patients, both medical and dental. One of our medical directors is a thoracic surgeon by training. And he said to me, he said, Eric, this is why I got into medicine, to have time to get to know my patients and deliver the care they need on a personalized basis. And that really made an impression on me that while we are giving this care away to our patients, which is a gift, also in a sense it can be a gift to the people providing the care, because this is a model that is not normal in our society. We do not have the economic pressures at our clinic that a typical private practice would. So we are a very unique organization in structure, and that Dr. Poore insisted when he started the clinic that everybody be volunteer, and they were for several years until I was hired as the first part-time paid employee as executive director. Dr. and Mrs. Poore were forward-looking. They knew that they wouldn't be or necessarily even want to be hands-on running the clinic every day for the rest of their lives. We now have 4 part-time paid employees, so that would be 2 full-time equivalents of employees. People always need health care. Doesn't matter what's going on with the economy or politics or who got elected, people still need health care, no matter what is going on in society around us. What I found out when I started here is that most of our patients are working. Because if a patient is so much in need that they have no income, they don't have a place to live, don't have a place to find food, they're probably going to qualify for that state Medicaid care under Access. Mrs. Poore, Dr. Poore's wife, she was a registered nurse herself and a midwife in her career. And she used to say it this way: our patients are people who are too rich to get on Access, but too poor to go out and buy insurance policies on the open market, which are expensive. So we are treating people who kind of falling through the cracks of the healthcare system as it exists today. And no matter what's going on with the economy or politics, people still need healthcare, and that's who we're here for. We find our medical providers, dental providers, mostly by word of mouth, by referral. Sometimes we've had people new to town and say, hey, what is this? What do you do there? I might be interested in volunteering. And again, those volunteer providers make this model of healthcare work. Every dollar that is donated here goes to the expenses incurred providing that care. And we are so grateful. We are particularly grateful to the Forest Highlands Foundation for their support over many, many years now. And Forest Highlands Foundation has had a tremendous impact on us by helping us keep that funding going so that we can continue to provide that care for free. I'll give you an example. When the pandemic hit, the first person to reach out to us was the president of the board of the Forest Highlands Foundation at that time, saying, Eric, we're concerned about the clinic. Are you going to be able to survive? Forest Highlands Foundation was way ahead of the curve, reaching out to us and offered us additional financial assistance at that time if we needed it. That was an extraordinary, extraordinary gesture. So that kind of heart is what's behind the Forest Highlands Foundation, and that's what we feel here at the Poore Medical Clinic. Those funds help us provide the materials and resources we need to give that care to our patients. We literally could not do this without the Forest Highlands Foundations and its donors and contributors. On top of the financial support that we need to provide the care, we have a shortage of dentists in particular who are willing to donate their time. If that is one half a day once a month, it would enable us to see more of our dental patients. One grateful patient story that sticks in my mind was a woman who wasn't yet old enough to be on Medicare and came here for some primary care, and Dr. Poore himself, through a routine gynecological examination, she was developing cervical cancer. She has told us in her own words that Dr. Poore saved her life. If she had not had access to a routine primary care screening, she would not have known that and probably would have not survived. Many, many tales, grateful patient stories. For a long time, we had a book in the lobby at the clinic for patients to sign in, and it was one of Mrs. Poore's favorite items in the whole clinic, of people saying thank you in such a heartfelt way. And the Sid Davis DDS Memorial Dental Clinic. Sid Davis was a local dentist, and he had his practice over in the Sunnyside part of town. He died tragically, way too early in life. His family was very happy to see that there was an interest in keeping his practice going. So we depend on the community to make donations to keep our clinic running. The impact Forest Highlands Foundation has on the Poore Medical Clinic is almost beyond words to describe. They have been so generous with us year after year, helping us meet our fundraising goal from that grant process. That ensures that we can keep the lights on and we can keep buying the medicines and the equipment we need to provide professional level care.